Jonathan Doe was born on 7/21/1940. He is a retired school teacher. Mr. Doe has not had an audiologic eval in 18 years. Results from 4/24/1995 indicate that he had normal hearing in both ears. Mr. Doe reported not noticing any differences in his hearing until more recently. However, his wife stated that his hearing has been declining in the past couple of years, about the past 5 to 8 years. Mr. Doe's wife resulted that he has trouble hearing the television and turns the volume up extremely loud. And when he is sitting in the living room with the TV, he does not hear her talking to him from the other room. He also has problems hearing his grandchildren when they talk to him, as well as other family members on the phone. He reported having gone to music concerts throughout his life, and when leaving the concerts, his ears would be ringing. The older he got, the longer the ringing would continue. Mr. Doe was very responsive and cooperative with answering the questions asked, as well as providing additional helpful information. The client's wife was also very cooperative and answered any other questions that the client wasn't sure about. This is the result of his audiologic eval from 1995. Mr. Doe was given a pure tone threshold test on 4/18/2013. Results show normal hearing thresholds in both ears for 250 Hz, 500 Hz, 1000 Hz, with a bilateral, symmetrical, sharply sloping, mild to profound sensory neural hearing loss for 2000 Hz, 4000 Hz, and 8000 Hz. The client also filled out a hearing handicap inventory on 4/18/2013. The client's overall score was a 54 out of 100. The client filled out the hearing handicap rating, rating different emotional and situational experiences relating to his hearing loss. The client reported 26 out of 52 points for the emotional questions relating to his hearing loss. The client reported a 28 out of 48 points for the situational questions relating to his hearing loss. The client's total score was 54 out of 100. For the assessment part of this, for this procedure, the client shows normal hearing thresholds in both ears for 250 Hz, 500 Hz, 1000 Hz, with a bilateral, symmetrical, sharply sloping, mild to profound sensory neural hearing loss for 2000 Hz, 4000 Hz, and 8000 Hz. The client also completed a hearing handicap inventory displaying that the client's indicated a significant hearing handicap due to his hearing loss. The suspected cause of the hearing loss is presbycusis. Further testing must be conducted to verify. Here's the results of his screening one more time. The plan for Mr. Doe is that further testing must be conducted in order to verify the existence of presbycusis and the extent to which it is affecting the client's life. These tests include speech recognition testing and word recognition testing, as well as follow-up appointments to help decide what else needs to be done. These tests will help to determine the extent of difficulty the client has with recognizing speech. Individuals with sensory neural hearing losses have issues understanding and recognizing speech, even when it is made louder. SRT will also aid in the diagnosis of where the hearing disorder is located in the auditory system. The SRT will determine the perceived prognosis for the client using the different treatment options. It will also help to decide which amplification system is best for the client. If determined through the testing that the client is a candidate for amplification systems, then the client will have an appointment for the fitting of a hearing aid. Mr. Doe will have follow-up appointments to make any adjustments necessary, as well as to repeat testing to determine whether the amplification systems are benefiting the client. This is the end of the overall plan.